for its breeding sites and destroy them. This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself from the bite of this mosquito.
A message from the Ministry of Health and Wellness.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Search for its breeding sites and destroy them. This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Protect yourself from the bite of this mosquito.
A message from the Ministry of Health and Wellness.
We care about our minimum wage earners. That is why we increased the minimum from the previous increase of 13,000 to now 15,000. And as our economy continues to improve, you can look forward to even more increases. Your government is caring for you.
Me, I go show them my way of justice.
I'm abused.
I need legal advice. I don't deserve this.
The truth of the matter is, justice there for all of we. The Ministry of Justice has trained more than 5,600 persons in restorative justice practices. More than 200,000 victims have been supported by the victim services. Legal aid has reached thousands island-wide. Make we talk it out, not fight it out. Call 888 Justice today.
Keep on playing. Come, let me take you down to the past.
Alright, first I go so. Alright, need some leaf put in that wax now. I don't know about who you know, but this is my favorite childhood game.
Hello, hello, hello. Hello, one and all, short and tall, big and small. I'm so honored that you are choosing to spend time with Amina.
Spend time with Amina.
Thank you very much, Stephen. Good morning, everyone. Thank you very much for joining us at this, our press update on Mpox, as we had signaled a few days ago, coming on the heels of meetings that we have had internally with the health team to assess the recent announcement by the World Health Organization concerning Mpox, and of course in keeping with our ongoing surveillance globally and locally to ensure that we provide the country with the appropriate updates and necessary precautions to ensure that we protect ourselves from this particular health risk. So I want to use the opportunity to first of all, alert the country on the developments related to Mpox. And of course, this is formerly called monkeypox, but we no longer refer to it as monkeypox, so it's Mpox. This is to bring to the forefront of our minds the precautions and interventions necessary should the virus re-enter Jamaica. And notice I say re-enter because we've had before, and I'll comment on that later. So on the advice of the International Health Regulations Emergency Committee of Independent Experts, the World Health Organization, WHO, determined that the upsurge of Mpox in the Democratic Republic of the Congo and a growing number of countries in Africa constitutes a public health emergency of international concern under the International Health Regulations Act. On August 14th, 2024, the WHO declared Mpox as such and noted that the virus had the potential to spread further across countries in Africa and possibly outside of the continent. A public health emergency of international concern is defined, for purposes of all, as an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. This definition implies a situation that is serious, sudden, unusual, or unexpected. It carries implications for public health beyond the affected states, national border, and may require immediate international action. As a reminder, Jamaica recorded its first case of Mpox in July 2022. Between then and March 2023, the country had recorded a total of 21 confirmed cases. And the breakdown of this over those years would be 2022, 18 cases, 2023, 3 cases, and to date in 2024, we have had no case, even though we had one suspicion, but it was confirmed as negative at one of our hospitals. Of the confirmed cases, 18 were male and 3 were female, with age ranging from 16 to 52 years. All cases were classified as Clade 2, which I believe the medical team can provide further explanation on as to what this category means later on. At this time, I'm going to move quickly into the Chief Medical Officer and ask her to elaborate on some of the more technical aspects of Mpox. CMO.
Thank you, Minister. Morning, everyone.
I don't think he can move.
Okay, let's go to the first slide.
Careful.
Okay, I'll do it from the phone. All right, so monkeypox, now known as Mpox, is a zoonotic viral disease caused by the Mpox virus. There are 2 distinct clades of the Mpox virus. We have clade 1 and clade 2. Clade 1 is from Central Africa, and it's known to be more severe with a case fatality ratio of 10%. Clade 2 is the West African clade, and it has a fatality ratio of about 1%. In 2022, when we had the outbreak, it was clade 2 that was spreading, and now in 2024, there are reports of clade 1 being spread. Next slide. Okay, so the former name monkeypox suggests that monkeys are the primary host, but however, the specific animal reservoir is really not known. And certainly there are transmission from other animals, such as rats and squirrels. Next slide. Transmission can be from animal to human or from human to human. And for animal to human, when a person comes into close contact with an infected animal or with consumption of contaminated bushmeat. And human to human, you have direct contact. Direct contact with Mpox skin lesions, scabs, body fluids, contact with clothing or linens used by an infected person, and droplets through coughing or sneezing of an individual with the Mpox rash, or via the placenta from mother to fetus during close contact after birth. The virus will enter the body through broken skin, even if this break in the skin is not visible, through the respiratory tract or the mucous membranes. So in the 2022 outbreak, from 2022 to 2023, there were 99,518 cases that were reported, confirmed. Of those, it's important to note that over 95,000 were in locations that have not previously reported monkeypox. And just over 4,000 were in locations that had historically reported monkeypox. And over 122 countries and territories reported cases, and of those 115 had not historically reported monkeypox. Only 7 of those countries or territories had historically reported monkeypox. And this is what the distribution looks like, and certainly you can see that certainly in all the WHO regions, you would see that there was spread in the regions of the Americas, the African region, European region, Western Pacific region, in the Southeast Asian region, and also in the Mediterranean region. Right across the regions of WHO, there was spread. In August 14, 2024, WHO declared Mpox, an outbreak, the Mpox outbreak of a public health emergency of international concern. And so far, in 2024, at that time of the declaration, there was 15,600 confirmed cases and 537 deaths. The increase in cases were seen especially since January 2023, and the outbreak was centered in the Democratic Republic of the Congo, more widespread than any other previous outbreak in that country. In April 2024, the Republic of the Congo actually declared a Clade 1 outbreak. In late July 2024, cases were rising rapidly in countries around DRC, including countries where Mpox had not previously been reported, for example, Burundi, Kenya, Rwanda, and Uganda. And there were reported cases of Clade 1. The presence of Clade 1b Mpox was confirmed in each country. Now, previously in the DRC, we would have had Clade 1a. So the new Clade 1b, actually emerged in 2023, and the concern now is mostly about the spread of this new Clade 1b. And Clade 1b has been detected in Sweden and Pakistan, and I think this morning we saw that there was also a case in Thailand. So if you look at the global monkeypox situation, certainly you would see that in the region of the Americas, the majority of the cases were there because of the 90-odd thousand confirmed cases, 62,000 cases, over 62,000 cases were reported in the Americas. This was followed by the European region with over 27,000 cases, and then you had the distribution across the other regions. Next slide. So the primary mode of transmission that we're seeing, certainly in the 2022 outbreak, what we had seen that there was the primary mode was sexual contact. And now in this outbreak as well, especially with respect to clade 1B, we're seeing that it's primary sexual contact. However, we are seeing transmission from close contact, certainly among children. We're seeing a high proportion of children in the DRC. And the main symptoms are rash, fever, so the main symptoms are, we're seeing that are rash and fever. Up to June 2024, just over 50% of our clients would have, that were confirmed, would have been positive for HIV. The Mpox vaccine against clade 1 and 2 is not generally available in the DRC, and that is, of course, of concern, as it is one of the main agents with the 2022 outbreak that was used to control the spread. WHO supporting countries.
Next slide, please. You have to direct the slides.
So let's talk a little bit about the clinical features. The incubation period for monkeypox varies from 1 to 21 days. Usually it's about 2 weeks, and usually you can have from mild to moderate symptoms. There is usually a prodrome, which is a feeling of being ill, usually a few days before a person starts developing symptoms with very non-specific symptoms. But then once symptoms start to develop, you have fever, muscle pain, intense headache, swollen lymph nodes, back pain, lack of energy, and a sore throat. And of course, the development of the rash, which usually takes place about 3 to 4 days after persons start developing symptoms. The monkeypox, the Mpox rash starts on the face and then spread elsewhere on the body, usually the palms of the hands and the soles of the feet, which is different from chickenpox, as we know that usually starts on the trunk of the body. So while there is a resemblance from the distribution of the rash, sometimes you can make a differentiation. Next slide. The illness is usually a self-limiting illness, usually lasts about 2 to 4 weeks, and most people will recover quite well. However, persons who have weakened immune system for various reasons may have a longer course of illness, and of course may develop further problems, sometimes even leading to fatality. It's important to note that persons will remain contagious as long as they have the lesions, and it is important to see that the lesions are cleared and new skin forms before persons are not able to transmit the disease. So, as Minister had said before, our last case of Mpox was in March 2023. So at this time, if we should have any case of clade 1B, it would be a new entry into Jamaica, as we have not previously had clade 1B. What was circulating in the Americas has been clade 2, and so this would be considered an outbreak. Mpox is a class 1 notifiable disease. That means that healthcare workers are expected to report cases immediately on suspicion to the parish health department and to the national surveillance unit at the ministry within 24 hours, regardless of whether they are exploring other diagnoses. There is a form that must be completed by our healthcare professionals, and this must be submitted to the national surveillance unit. I think we can just a little bit to speak about prevention in terms of, because we know that we have been seeing the spread mainly through sexual contact, safe sexual practices are important. We encourage persons to use condoms and to stick to one sexual partner, and physical distancing, reducing close contact as much as possible, wear masks because for persons who are in close contact, speaking to one another, coughing or sneezing can transfer droplets, and of course frequent hand washing and hand sanitization. Of course, you are to seek medical attention if you develop fever and rash after any international travel, or if you've had close contact with travelers within the preceding 3 weeks. Healthcare workers are to have a heightened sense of awareness. We are increasing our awareness sensitization sessions with our healthcare workers, and they must report suspected cases to the parish health department. We can stop there.
Okay, thank you very much, and we apologize for the awkwardness earlier of the presentation. But hopefully we can mount the slides on the website of the ministry. So if you need to revisit those, then you can. Okay, so given the WHO's declaration, the country has been on a high alert for the virus. In fact, I'm just reading on the newswire here, subject to confirmation, that one of our closest neighbors, Cayman, has recorded 2 cases of monkeypox. So it is, we will await confirmation on that, but the reality is that we do expect the risks because of the openness of our borders, the normalness of travel and international travel, and of course the interaction with persons from far and wide, hence the importance of the conversation now, even though we are not yet seeing a case in Jamaica. It is to be noted that in non-endemic countries such as Jamaica, 1 case is considered an outbreak. The virus is a class 1 notifiable disease, as said earlier, means that clinicians should report suspected cases immediately to the parish health department and the ministry's national surveillance unit, regardless of whether they are exploring other potential diagnoses. I would like to say, too, for the public that if you observe and you suspect, or you have symptoms, or others have described, and you can visually see things that suggest the possibility of, then encouraging those persons to visit their doctor would be the best option. This means that as of Thursday, August 22nd, 2024, there have been no cases of Mpox reported. However, due to the public health risk associated with a single case of Mpox, members of the public should take the necessary precaution to safeguard themselves from this disease. The government, through the Ministry of Health and Wellness, has heightened its surveillance and notes that the overall goal of surveillance, case investigation, and contact tracing in this context is to break chains of human-to-human transmission and to stop the outbreak. Surveillance is critical, therefore, at this time to rapidly identify cases and, by extension with each case, the clusters, in order to provide optimal clinical care, isolate cases to prevent further transmission, identify, manage, and follow up contacts to recognize early signs of infection, to protect frontline health workers and identify risk groups, and tailor effective control and prevention measures. Our key actions at this time will focus on the following: heightened surveillance at our ports of entry. This means that we will increase messaging at our ports, and we will interview travelers who have visited countries of interest in the last 6 months. Anyone with symptoms will be treated according to our protocols. Persons without symptoms will be issued health alert cards and told to contact the health department if they develop symptoms. In other words, we are monitoring the countries where Mpox is present, and persons coming into Jamaica from those countries of concern may be subjected to a higher level of surveillance questioning by the health team. But generally, we will post appropriate notification at our ports of entry so persons can be aware of symptoms and the precautions that need to be taken. This may mean some inconvenience, and we ask for persons' patience if they have to be inconvenienced, because this for us is an important issue, and it is our obligation to protect the population and to protect those who may be affected. There will also be increased surveillance in our health facilities, as persons with suggestive symptoms and travel history will be tested and treated according to our protocols. Members of the public are also to advise the health department if they develop signs and symptoms. I spoke to that earlier. Additionally, the ministry has begun its national public education and community engagement program. And again, I implore all Jamaicans to be on alert and to take the necessary precautions to safeguard yourself, your family from Mpox, as well as other viral illnesses. And that's it for now, basically. We're going to be ensuring that the country is made aware of this. I want to state that this is not an attempt at creating any panic or undue alarm. It's, however, an important notification to the public that this is a going concern and we must prepare ourselves and protect ourselves to avoid infection, whether from one person or for a community. This is in the interest of our country, and this is how we have to treat with these things, particularly when they are declared an important going concern at the global level. Thank you very much, and we are now available for any questions.
Thank you very much, Minister. So we're asking our media colleagues on the Zoom to use the raised hand feature to pose their question to the panel. Okay, Emma Lewis, you can go ahead.
Hello, sorry, I couldn't unmute myself. Good morning, everyone, Minister and everyone. I wondered, I mean, I think this is an obvious question, but who are the most vulnerable citizens to monkeypox? Mpox, sorry. Is it just basically people with lower immune systems, senior citizens, etc.? And should they be wearing masks? Should we all be wearing masks? And what are the ways that we can protect ourselves? I also wanted to know what a clade is, because I've never heard that word before. It's basically how we can protect ourselves and who is the most vulnerable. Thank you.
Okay. Thank you, Emma, for your question. So just first of all, there are two types of Mpox virus, and the types are described as clades. So it's clade 1 and clade 2. And subsequent to having defined those, then we would have had variations on those, just as how we've had variations with COVID with the development of new strains. So we would have had clade 2A and 2B and clade 1A and 1B. So for clade 1, clade 1A, we knew about from before. It was present in certain countries in Africa. However, the development of a new clade, clade 1B, was noted in 2023. And there is concern about this new clade because not enough is known about it. And in terms of concern, who should be, concerned about it? Because we have this unknown, where it is now that we have the possibility of 3 different clades circulating, clade 2, clade 1A, and clade 1B, and a lot is not known about the new clade, then everybody should be concerned. We know that primarily during the 2022 to 2023 outbreak, it mostly came from close sexual contact. However, we would have seen from the reports coming out of Democratic Republic of Congo that we are also seeing outbreaks among children. And in Congo, we have a lot of camps where a lot of children are in close contact, and that is said to be driving the spread. However, there are reports as well that the new clade is more transmissible. And so once it comes into country and it comes onto this side of the world, it's very, very important for persons to report so that we are able to define the symptoms, persons that are affected, and to see who is at more risk But presently, I would say that everybody is at risk based on the different types of Mpox that there are, and close contacts occurs among all age groups and particular children, and we have kids going out to school come September. So it's very, very important for everybody to be concerned, for symptoms to be reported very early so that persons can be isolated to stop transmission.
Just to clarify, just got some feedback out of the Cayman Islands that there is actually no case of Mpox in Cayman. So what was being transmitted was fake news. So just to clarify that. Thank you.
Thank you, Minister. Thank you, Simo. Sashana Small from the Gleaner, you can go ahead.
Hi, good morning, everyone. I want to find out if we have the facilities here in Jamaica to test for the suspected cases, the different clients.
Yes, we do have the capacity to test, and for now in country we have the ability to do 2,000 tests for the Mpox virus and to do 1,000 differentiation into the clades. So we do have the ability to test in country. We have, in association with our international partners, including PAHO, we would have developed that capacity.
CMO, you want to comment on the vaccines and the limited quantities that we have and how it is utilized? Because there is increasing requests for persons asking about vaccines, and I think there's a protocol around how those are used.
Okay, so in terms of vaccines, mass vaccination and vaccination prophylactically for travel, etc., is not recommended. The vaccine is recommended for persons who are close contacts, for persons who have been confirmed to have Mpox. So it is not given to everyone, especially now when the vaccine is in short supply and countries are being asked that have stocks of vaccine to deploy those vaccines to the areas where there is most need, and that's in on the African continent. So there is not, it's not a, everybody runs out to get an Mpox vaccine so that they can prevent getting it. And the persons that are to receive the vaccine, of course, there would be a certain amount of information that would need to be shared for them and for there to be consent to receive the vaccine. So we do have limited supplies available in country in case we do have cases.
And I just wanted to comment on that it's an important point to raise, because I know persons have approached me personally, and I know that would be a logical expectation around the fear and uncertainty of the virus. So again, to reemphasize and to reassure that Jamaica has been proactive in the past as a government, as a country, and so we do have stocks. However, it is only administered in the process, maybe to simplify by saying, of contact tracing. Once you have discovered a case, then you determine who are the exposed individuals in and around that case, and then you offer the vaccines to provide the protection to those persons. It is not something that you should just want to get and have access to. That's not the protocol around it. And as the CMO said, there's a shortage, and the intention is to look at the numbers that we have to determine what we need to reserve for ourselves, and possibly to offer some of the vaccines that we have to other countries that are affected. We would normally collaborate with the WHO in determining which countries those would be. The obvious ones, of course, are where the virus is highest. But I think it is a good thing that Jamaica does have stocks, and if necessary, we can use those stocks both to test as well as to give protection to those who are exposed.
Thank you, Minister. And I have two questions for you, sir. They're asking online in terms of, given the WHO declaration and what's happening in the other countries, what is the mood of the government and the cabinet at this time?
Well, the Prime Minister has been briefed. Cabinet has been on break for a few weeks, the summer break, but the Prime Minister is fully aware of the circumstances, and he and I have had dialogue, and he has gotten the appropriate technical brief. I think that we have enough experience as a government coming on the heels of COVID and also previous exposure to Mpox to do what is necessary to provide information in the first instance, which is what we're doing, and to prepare ourselves. As I said earlier, the previous comment, the fact is that Jamaica is perhaps more prepared than most other countries around the world. For starters, we have some experience, having had cases back in 2018, I believe it was, and 2019. 2020 and 2022. 22 and 23, sorry. We did make provisions for testing and still are able to do that. And we have vaccines in terms of giving protection to other persons who may have been exposed. And so what is important now is to provide information. And this is what we're doing without causing panic. So I think we are in a level of comfort in terms of managing the circumstances, and just to reassure Jamaicans that we will do whatever is necessary, as we have done in the past, to provide adequate protection. But you have a role to play also, and hence the need for you to be observant, protect yourself, see your doctor if necessary, and provide information where required.
All right, thank you, Minister. I have a question from Shamila Pullen from TVJ, unrelated to Mpox. She's asking for an update on the St. Anne's Bay Hospital case with the pregnant lady. So
let me begin by saying that that situation, which was aired on that the station that the journalist is associated with, is a very unfortunate one. You know, we always empathize with any patient, any Jamaican who has had an experience where they have experienced trauma and sadness because of unexpected results of any particular circumstance. And in this case, it involved an expectant mother and the child, the baby. I have asked for a brief. I had actually asked for a brief from last week and received a brief on what had transpired. I had inquired if appropriate counseling and support was provided and was told this is the case. Clearly, there are still concerns by the mother and the patient, and I think in light of those concerns, we have an obligation, we have a duty to respond and to provide adequate information and appropriate levels of support. And there is a process where if the hospital is found to be liable for whatever reason, then that process should be allowed to take its course, even while we provide comfort and support to the patient. It's part of the emphasized area that I've been talking about, administering care with compassion, which sometimes I think we don't do enough of. So that's a kind of general thrust. Now, in specific terms, since the last day or so, I've asked the team to go back to the table and to review and to bring the family in and to have a conversation to see if there can be a better understanding between both parties, for want of a better terminology. That meeting took place yesterday, as I understand it. I was briefed this morning about aspects of that meeting. A report is to be generated, and I'm on my way to St. Anne now for another event, and I will get some better particulars there if they have it. But suffice to say that the follow-up has taken place, and I'm hoping that out of that follow-up, some sort of better understanding can be achieved, and where further action is required, that action will be taken one way or the other.
Thank you very much, Minister. We have a question from Courtney Lewis from CVM. You can go ahead.
Hi, morning, Minister and other members of the panel. Up to last week, there were reports of the university hospitals emergency room being at capacity. What can you tell us about the status of our hospitals and isolation wards at this time?
Okay, well, I've also inquired, maybe CMO can provide a clinical word on the extent to which our hospital system is under pressure at this time. And this happens. It's a cyclical scenario where a particular point in time you have an increased demand on the system. Let me create the context as I understand it, because I was concerned when I saw the media release. The University Hospital as maybe one of two tertiary level institution in the country at the highest level, the only regional institution that provides training and therefore has in its human resource capacity some of the highest levels of training, who in turn become trainers for young doctors and otherwise, will see demand on its services perhaps beyond other institutions because of the nature of the institution and the level and numbers of experts that they have. So from time to time, well, as a normal course, referrals are made from other institutions across the country because the University Hospital of the West Indies is the only institution that may be able to provide that kind of combined levels of service because of the experts that are there. Depending on what is happening in the country at any point in time, where you have outlier events, whether it is man-made or natural, that institution will come under increasing pressure and referrals will become a lot more than normal. My understanding is that they are going through that process now, where they are being asked to take patients from other institutions, separate and apart from their normal course of activity, where people can turn up at A&E, and they have to be managing that in a way that allows the priority cases to be seen, and where those referrals may not be necessary, then they revert back to the original institution to treat with those patients. I think the release may have created a particular impression, which is concerning to me, that they were not taking referrals at all. This is not the case. When I spoke to the CEO and the head of the medical team, they are taking referrals depending on the nature of this particular case. And the release gave the impression that they were not. So yes, they are under pressure, as I understand it, but depending on the case and the need to have the experts there deal with a particular case that may only them alone can deal with, those referrals are being accepted. What I had advised them to do is to coordinate with the hospitals as opposed to the general public, or should I say in addition to the general public, because it appears to me that the matter may better be handled by institutions talking to institutions rather than putting something out in the wider public that may create the wrong impression or even uncertainty, fear, or even panic. And I think some of those discussions are taking place. So yes, they're under pressure, but as I understand it, they are still taking referrals depending on the particular case.
Right. So I just want to add a few comments to that, to say that hospitals right across the country tend to become overwhelmed with the number of cases coming into the emergency department, and persons, it's a sicker person that is coming into the emergency departments which result in the emergency department not necessarily being able to resolve the problem, and persons have to be referred to be admitted in hospital. And so there is a huge demand for hospital beds. Now, as we come closer to the end of the year, we find that those numbers usually tend to increase because we have an increase in respiratory cases as well as increase in trauma, as well as we do have an increase in the number of persons that are coming in with complications of non-communicable diseases such as diabetes and hypertension, because persons tend to become non-compliant towards the end of the year. So what I would want to encourage the public to say that our primary care facilities are open. Many of the times that persons end up in hospitals with problems associated with their non-communicable diseases, and these are the majority of persons that end up in hospitals in the emergency department, it is because of non-compliance. The non-compliance with medication, non-compliance with the other routine care that you should be taking of yourself. So it really comes back to the responsibility that we have to ensure that ourselves and our family members are compliant with treatment, because this will keep a lot of persons out of the need to visit the emergency departments. So if, however, there are problems, your first level of care is your primary care center. And this may be a public health center, or this may be your general practitioner. Many of the times that persons go to the emergency department, their problem could have been solved in primary care. Certainly, we would want that our higher level institutions, such as the University Hospital of the West Indies, the Kingston Public Hospitals, the Bustamante Children's Hospital, Victoria Jubilee Hospital, that they are open to receive the more complicated cases, more severe illnesses as referrals from the other peripheral hospitals. And so we don't like to hear that these hospitals are overwhelmed, because it means that there is a delay in care for persons with severe illnesses that really require that level of care. And so while we know that these hospitals serve the communities that they are in, and so the very it's very easy, you know, when you have a problem, if you live within a community that is next to the hospital, to just to go to the hospital. But we're asking persons, stop at your primary care centers first, okay? And to ensure that you are taking your medications, you're compliant. Trauma and both injuries that are interpersonal injuries, intentional and non-intentional, also tend to really bind up our emergency departments. And many of these are preventable. And so, you know, and persons are really must pay more attention to how it is that they deal with interpersonal conflicts, so that they can prevent injuring one another and ending up needing to go to the emergency department. A plea to parents in particular, because we do note the number of injuries that are increasing in children, that they pay attention to the children to ensure that they don't have accidents. They try to supervise them as much as possible, and also try to deal with the problems, the interpersonal conflicts that start from early, to try to resolve them and to try to prevent some of these things from coming into the emergency department. So there's always a cry as to what the hospital should do, but there's a lot that the public can do to prevent themselves from needing to be in the emergency department. And people need to really pay attention to that. We are in the summer months, and really coming up on closer to the end of the year, it tends to get worse. So keep yourselves out of the emergency department by taking your medications, ensuring that you're compliant with other treatment plans. Start to deal with issues of violence and interpersonal conflicts in a more reasonable manner, so we don't get to the point where we're injuring one another. When you're driving, make sure that you're not drinking or under any other influence when you're driving. wear your seatbelt. All of these things are things that you can do to prevent yourself from coming to the emergency department.
Thank you very much, CMO. I have one more question from Abigail Barsley from Nationwide. You can go ahead. Go ahead, Abigail. We're not hearing you. Okay, she's not speaking. All right, I think those are our questions for now, Minister. I'll just hand over to you for your closing remarks.
Okay, thank you very much. So there's not much more to add except to say that this is the current state of play as relates to Mpox. The country, the public health team, the government is prepared and ready to confront any risks that may eventually land here on our shores. We are soliciting the support of the general public in terms of any information, any observations. There may be some inconveniences at our ports of entry, particularly for persons coming in from countries that have been affected. But we do have the capacity, the experience, and indeed the raw material that's necessary in the case of testing, as well as vaccines if necessary, to deal with the situation. So from Kingston, the OEC office, I want to thank the team for the efforts that they have put out to get us to this point, and let us work together to overcome this another challenge in our public health space. Thank you very much.